I think we've got a very exciting presentation for you because we've got a very exciting playbook that will really let us start this work across the country in a very powerful and profound way. So, to introduce everything, I'm going to turn this over to Judith Steinberg.
Thank you, Michael, and welcome everyone. My name is Judy Steinberg. I'm a primary care internist and infectious disease specialist, and a proud member of the Board of Directors of Primary Care for All Americans, or PC4AA. And just a word or two about myself. I practiced at community health centers in Boston and safety net clinics in Boston and Worcester for many years, and worked to advance primary care transformation in Massachusetts. And then 8 years ago, I moved to Washington, D.C., and served as the Chief Medical Officer at the Bureau of Primary Health Care at HRSA in the U.S. Department of Health and Human Services. More recently, I was a senior advisor to the Assistant Secretary for Health, and there I led the HHS initiative to strengthen primary health care. So, on behalf of the board, I want to welcome you all to our Teach-In, Learn-In Zoom that's introducing tonight the PC4AA local playbook. And I want to thank you for joining us tonight. With over 1,000 people from 40 states, the District of Columbia, and 350 zip codes, we're reminded of the incredible momentum that we've built together to develop and advance PC4AA. This growing movement to provide primary care to everyone in America continues to spread, and it's been fueled by your dedication and commitment. So as we carry this momentum into the new year, it's a time for fresh starts and also bold strides going forward. So tonight we celebrate not only a new beginning, but also the formal release of our local playbook, which is a significant milestone in our shared journey toward providing primary care for everyone. I'm thrilled that we're going to discuss the local playbook with our panel members, who are national leaders in bringing primary care to all Americans, each in a different way. The Board of Primary Care for All Americans would like to give special thanks to the co-chairs of the PC4AA Local Playbook Work Group, Doctors Sarah Pasteur and Matthew Libby, along with all of the members of the work group. With their hard work and dedication, and not to mention their drafting and redrafting and editing, they've created a really valuable resource for our communities. We'd also like to thank Rodney Young, ace graphic designer, for making the playbook just so visually stunning. So now it's my great pleasure to introduce our moderator for this evening, Patty Armstrong, and to extend my sincere thanks to all the presenters. I'd also like to thank the PC4AA Zoom committee, as well as John Wright, Brian Kaiser, Patty Armstrong, and Liv Varady for organizing this event. And with that, take it away, Patty.
Thank you so much, Judy. Hi, everyone. I'm Patty Armstrong. I'm a mom focused on building a caring community. I've spent my professional career creating community through developing local resources in collaborative spaces. So I want to start by thanking you all for being here tonight. By joining, you're helping us build a movement, one that's focused on providing healthcare for people in every neighborhood, in every community, primary care for all Americans. Please take a moment, if you haven't yet, and share where you're joining us from in the chat so we can see where we are working together to build this movement. And as we do, let's refrain from using professional titles. This space is about focusing on the importance of being here together, engaged in this work, and valuing the ideas and commitments that will ultimately drive this movement forward. Now, let me introduce our amazing panel members who will share their thoughts on how the PC4AA playbook can be used to make a difference in our communities. Anne Greiner is president and CEO of the Primary Care Collaborative and has dedicated her entire career to advancing the quality of U.S. health and healthcare. She has more than 20 years of experience, including senior level policy research and communication roles at prestigious national not-for-profit organizations. Prior to leading the PCC, she served as Vice President of Public Affairs for the National Quality Forum, Deputy Director at the National Academy of Science, Engineering, and Medicine, and Vice President Policy at the American Board of Internal Medicine. Dave Chase is the founder and CEO of Health Rosetta, an organization transforming health plans into drivers of well-being and wealth. Under his leadership, Health Rosetta has set industry standards for contracting, procurement, and data access, empowering employers and providers to deliver transparent, cost-effective healthcare. Nice thought leader and best-selling author, Dave is leading the charge to restore the American dream by reshaping healthcare for the better. Last but certainly not least is Tasha Dawson, who's the Deputy Senior Director for Strategic Partnerships at Families USA. At the Office of Minority Health, Tasha built strong, meaningful, bipartisan relationships across sectors and collaborated on the development and implementation of strategic outreach in the science, research, and healthcare spaces. So for tonight, we are here to both teach and learn from each other. To start, we'll hear from Sarah Pastor and Matt Libby, chairs of the Playbook's work group, who will introduce the Playbook to you. Following that, Anne, Dave, and Tasha, our panelists, will share their insights on how the PC4AA local playbook can be used to make meaningful difference in our communities. Afterwards, we'll open the floor for questions and comments. So we encourage you to contribute by submitting your questions in the chat throughout the session. Please stay with us at the end of the session where we will have time to do a Q&A and discussion. We'll be exploring how you can help bring primary care to everyone in your own neighborhood and community. Now, to dive deeper into the PC4AA local playbook, I'll turn it over to Sarah and Matt.
Greetings, everyone. So glad that you can join us tonight. I'm Sarah Pastor. I'm a family physician in San Antonio, Texas. I work full-time for Elation Health, which is a primary care focused EMR company. And I also practice part-time in a direct primary care practice here in San Antonio. I'm on the board of Primary Care for All Americans and co-chair with my colleague Matt Libby of the Playbooks work group. Access to high-quality primary care is a fundamental right. Yet in the United States, millions of individuals and families lack a reliable source of this care. And it's a problem that has dire consequences, from poor health outcomes to high costs and significant health inequities. So Primary Care for All Americans seeks to address these issues by championing a grassroots approach to healthcare transformation. PC4AA believes that everyone should have access to primary care, no matter where they live, and in doing so, it intends to make healthcare fair, affordable, and effective for everyone in the country. But transformation starts in the community. Communities are the testing grounds for innovative policies and programs that can scale to state and national levels. Local work groups play a pivotal role in identifying barriers and gaps in primary care access, building coalitions across stakeholders, advocating for policies and programs tailored to their unique needs, and demonstrating local successes which can inspire broader initiatives. So before we dive deeper into the playbook, I want to take a moment to thank the incredible team that worked tirelessly to bring this vision to life. The local playbook is the result of the contributions of many dedicated individuals. And I want to acknowledge and express our deepest gratitude to the following members of our Playbook work group. Along with myself and Matthew Libby, also Brian Kaiser, Kurt Stange, Judith Steinberg, James Tamarkin, Michael Fine, Julie Ojemaya, Pat Tokars, Tasha Dawson, Dot Dunn, and Andrew Saul. Without their expertise, commitment, and collaboration, this important resource would not have been possible. So thank you all for your hard work and dedication to improving primary care access for everyone.
Thank you, Sarah. So just to briefly introduce myself, I'm a family physician on Cape Cod, Massachusetts. I've worked most of my career in community health, spent a little bit of time in the startup world, and I'm currently the chief medical officer at a health center that serves the unhoused population on Cape Cod. And I'm on the board of the Massachusetts Academy of Family Physicians. So with Sarah's inspirational words, you might be asking now, how do I get started doing this work in my community? And that's exactly what the local playbook is written in order to do. It's a guidebook to help you get organized, to assess, the local primary care landscape, and then identify opportunities to improve access to care, to build a coalition in your community, and to affect change. And what distinguishes primary care for all Americans from other advocacy groups around primary care is that this is a grassroots movement, and the first grassroots movement that we know of to work toward change in this way. So it's not just from people like myself and Sarah and many other people who helped write this, who are already physicians or otherwise working in the healthcare system, but it's people who have lots of different perspectives and lots of different ways of approaching these problems. So it's for everyone in the community. And the local playbook is the first document of its kind that we know of that is written to help catalyze a grassroots movement like that. We want to emphasize that this is a playbook. It's not a cookbook. It's loaded with a wealth of helpful resources to help you along your way. You'll be able to read about and learn from successes in other places that have done similar things. And from there, you can decide what efforts might be most needed or helpful or realistic in your community. Our vision is that this will become a living document with groups around the country sharing their successes and challenges and informing future updates. It's also important to mention that this complements our previously released state playbook, which can be found on the website as well. The state playbook focuses on advocating for policy change at the state level, which is another critical layer of addressing this crisis across the nation. And I borrowed this last piece from something Kurt Stange said in one of our meetings, so I want to give him credit for it. But how does a movement happen? It starts by doing things at the local level that seem small until they're not. We envision that this is a seed that grows exponentially, building toward a tipping point. And with that, I'll hand it back to Patty.
Well, thank you, Sarah and Matt and the team for sharing this playbook with all of us. Thank you for sharing your insights about what the local playbook is and the significance of creating it. So our three panelists have been selected to share their perspective on how this resource will influence the work being done alongside like-minded initiatives. So Anne, are you there? We want to welcome you again. And can you tell us where the local playbook fits in the national effort to bring primary care to all Americans?
Sure. Well, thanks, Patty, for the question. And I'm delighted to be here this evening. This is a really important issue to solve for, because I think if we strengthen primary care, the health in the nation is going to improve. And we all want health. I mean, we all want to be able to be our best selves, and health is a critical part of that. And my observation is that we need work on multiple levels. We need work on the national level, and that's the organization that I lead. We do national work, and we work with many partners, some who have joined us this evening. We need work on the state level, because a lot of policies actually fall under the jurisdiction of the state. And very importantly, and the focus of our discussion this evening, is we need a grassroots movement. I've worked on national policy my whole career, but when I began working at the Primary Care Collaborative, which is an organization of 70 different member organizations from all different stakeholder groups, and the commitment that they share is to strengthen the foundation of all high-performing healthcare systems across the world. And I started to read about social movements. And I just want to recommend this book, How Change Happens, because the author, Leslie Crutchfield, studied social movements, those that are liberal, trying to tap down on smoking or for marriage equality, and those that you would consider more conservative, like gun rights, and really looked at what made these movements successful. And the big conclusion of the book is that grassroots are essential. You need to have national policy, but you will not be successful unless you have grassroots. So I am really indebted to Michael Fine and other leaders from Primary Care for All Americans who have started this movement. I think it is going to be an important part of our ability to shift our system from a system that is more focused on addressing patient needs when they've already gotten quite serious. So we're much better at delivering care that specialists are traditionally delivering, or hospitals, acute care. And we're much less good as a healthcare system in keeping people healthy or restoring them to health early on in a condition that they may have. So the grassroots movement is absolutely essential. I think that when I consider how an organization like the Primary Care Collaborative works with grassroots, is when we go in and talk to national decision makers, either in the administration or on Capitol Hill, they really want to understand how does your policy work on the local level? Who cares about this? Are they getting phone calls from their constituents saying, we can't find a primary care physician or nurse practitioner or PA? And when we find one, the experience is such that our visits are very short. We don't have the time to spend, or we can't afford, even though we may have health insurance, to actually avail ourselves of primary care services. So there's a raft of problems, but I think national decision makers need to hear from local communities that they're not able to get the kind of care that they want, and it's increasingly challenging to keep yourself healthy. So I think that the involvement and the voice and the creativity and the ideas that local communities bring into these issues is very critical. I just want to give you some examples of where this has worked. So these authors looked at grassroots, they looked at social movements, both social and environmental, from the 1980s into the 2000s. And these researchers found that those with strong and robust grassroots, measured by both size and intensity of the base, win. And they looked at marriage equality, they looked at reducing drunk driving, they looked at tobacco control. And all of those movements, which had national policy as a part of them, were successful because of grassroots efforts that brought examples, that knocked on the doors of Congress, that made phone calls, that made their voices loud and clear. So I'm delighted to be here and have this conversation with all of you this evening. Thank you.
Thank you so much, Anne. That's, very empowering for each of us to know that we have a voice in it. And that's really what it takes, is that individual piece. So thank you so much for that insight. Dave is one of those people who's really used his voice. Dave, you and Health Rosetta seem to be everywhere in the US now, disrupting maybe the old way small employers and local governments buy insurance and adding primary care for all employees to that equation. So can you help us to understand how communities can support employers as they relocalize health, which is the title, I think, of your incredible new book on that process.
Yeah, and I'll second Anne's book recommendation. I read that book as well. It's really good. I've really become kind of a student of system change and also recommend the writings of Donella Meadows and Deborah Fries. There's some great work there. One of the reasons I was brought into this was to bring the employer perspective. And since employers provide more healthcare than any other category, 3 times Medicare, twice Medicaid, you really can't solve healthcare without tackling employer healthcare. Many believe it's one of the original sins of our healthcare system, but as we've seen time and again, it can't be wished away. So how do you turn it into the source of redemption? And, echoing some of what's already been said, my big piece of advice is start small to go big, go local to go national, and, talk is cheap. Sustainable action, sustainable change happens through practical implementation. And there was actually a great TED talk that talked about successful revolutions, nonviolent revolutions. You only need 3.5% of the population to tip a market. And we're actually seeing that at a local level. And I'd encourage people to not be dissuaded by so many who are really suffering from Stockholm syndrome and kind of the learned helplessness that the industry has really enabled. For us, 2024 was a huge turning point in this movement, which we could get into. We launched in basically Labor Day of 2017. I think of it as social movement and social enterprise. It was published my first book, and that was also when my TED Talk came out, with the understanding that employer-based healthcare had turned healthcare into the number one driver of wage stagnation for 30 years, debt and bankruptcy. Yet there were a handful of employers who discovered what I call healthcare's Rosetta Stone. And despite the conventional wisdom that if you're going to change healthcare through employers, you had to do it with jumbo employers, just not the case. I'm all for jumbo employers doing it, but the reality is 3/4 of employment is companies under 10,000 employees. And though we have unions with over 200,000 members in our movement, most of the action is in companies under 1,000 employees, and particularly in the kind of 50 to 500. And our hypothesis when we found these 5 organizations that had succeeded, that if we open sourced how the best health plans in America operated, we could spark a movement. And the biggest inspiration for us was a Florida hotelier that was the focus of my TED Talk, if you want to Google that. The short version is very high disease burden. For example, 56% of pregnancies categorized as high risk. In Florida, which is the home of the most price gouging hospitals in the country, they've cumulatively saved over $540 million, benchmarked against other like employers. But really, the heart and soul of that is because of great primary care, and then also some smart contracting outside of the traditional mega carriers that have kind of had a vice on our market. And so today, if you fast forward to 7.5 years later, we've got thousands of employers consistently saving 20 to 55% per capita with the best health plans in America. And they all freely share their secret sauce at like our annual gathering, for example, which we call Rosetta Fest, that's in the late summer. And it's sort of akin to how rural electric cooperatives, about a century ago, there was a market failure. And now what we have is sort of the equivalent of that kind of cooperative health plan utilities. We call them community-owned health plans. And so I don't totally filibuster this session. I'll end there, and I'll put a few links into the chat if you want to dig into more. And the final thing is one of the successes I'll put in there. It started with a single employer with only 38 employees, and now it's thousands of employee lives in a community, and it's really transformed that community. So I will pass the baton back to Patty.
Well, thank you so much, Dave, for sharing your insights. And again, so empowering to hear it doesn't have to be the biggest of mountains that we climb first, right? We can start, with a solid plan and a solid business plan to walk forward, which is what I think we have here with this local playbook. So thank you for your insights. Tasha is joining us with Families USA, which has helped spread the word about the need for healthcare reform and paved the way for the Affordable Care Act. Give us the perspective of our communities. Does this playbook go far enough helping communities to take back control of their healthcare, starting with primary care?
Oh, that's a good question. Well, one, thank you so much. It is wonderful to be here with colleagues that are mavericks in the space of healthcare, health advocacy, and it was an honor to be able to sit on this working group and really be a part of this. And so we know how empowering communities with access and comprehensive, high quality primary care can transform lives, especially in underserved and disproportionately impacted systemic inequities. So this playbook is a critical step forward. It provides actionable strategies to help communities understand the value of primary care, which, that's like start there. That's the baseline, and how to advocate for stronger systems. But I think I'm gonna be a troublemaker, a good troublemaker. But the question I want to answer the question with the question. The question of whether it goes far enough depends on how it's used. So I kind of say I've been doing community work for a very long time, and said grassroots movement, and I just all of the goosebumps, because that's my word. I've been grassroots, grass tops. I've done it all, but really the movements start there. And for me, in that space, resources only work when communities can see them. Resources only work when communities can access them. And so for this playbook to really empower communities to take back control, it's got to be paired with a real investment in them. And I think this work group invested time, and we're very meticulous, very intentional with the things that were laid out. And so this workbook creates an infrastructure and culturally and linguistically appropriate services and addressing social determinants of health that affect access and outcome. So I think every community deserves a seat at the table. Everyone deserves to know what their resources are, what their options are. They need to see themselves in the solution, feel equipped to advocate for changes that reflect their unique needs. That's how we ensure that it's not just a guide, but a movement towards more equitable inclusion in the healthcare system. And so I think this playbook is not only an important tool, but the actions that follow. That's the partnership. That's the policy change, the community-driven leadership. That'll determine whether we succeed in reclaiming that primary care. And I'll re-echo that the resources work when they're worked. And that's what we've got to do with this. So it absolutely goes as far as our communities and the leaders who are putting this playbook into action will take it. It's going to go as far as they'll put in the effort and they'll put in the understanding to make it something that brings what the community needs. So I hope I answered that and not too much, and I wasn't too much of a troublemaker.
Absolutely, Tasha. I remember having a conversation with someone about, a lot of similar experiences, and they said you're only going to get out of it what you put into it, right? If you just read it, if you let it collect dust on the shelf, right? Like, it's beautiful. If you have not read the playbook yet, I know the link has been dropped into the chat. It's good to read. It is very comprehensive. It gives you all kinds of tools and resources, and even some descriptions of ideas of places to go and links of others that have been successful. It's super, super comprehensive. Great job by the team. But again, to Tasha's point, you're only going to get out of it what you put into it, right? So you've got to work the plan to make the plan work, right?
Absolutely. Absolutely. And I want to include in that it's inclusive.
Mm,
And that's something that matters too, because, we can get in these spaces. We're all subject matter experts in our fields, and, we get the jargon and we get the alphabet soup. But this playbook breaks it down for many different understanding levels. And I think that's also important too.
absolutely. Bringing everyone along so that we can build this movement as big as possible. Well, thank you, Tasha, Anne, and Dave. Just so much for your insights and just how we can apply this nationally, corporately, locally. I think there's just such value in that. I'd love to take some questions from the audience or from you guys right here on the panel. And so if you have questions, please feel free to drop them in the chat. All right, we've got a couple coming in. Pam's joining us from New Bedford. They've got a local group launching there. Pam, do you want to come off of mute and ask your question?
Sure. We have a local work group that's been meeting since early September in New Bedford, Massachusetts. And I want to make sure that we continue to keep the flame burning within that group. So what are your suggestions to do in that over time so that the group doesn't fizzle?
Hi, Pam. I'll jump in on that one. I think as many of us have worked with coalitions on coalitions, we know that coalitions will start off hot and then they will get a little cool depending on what's going on. I think always taking that temperature of what's relevant, what's going on, what the community cares about right then, because it's going to ebb and flow. So understanding what's going on in the community, what's important to both providers, both consumers, what's really mattering to them at that moment. What national event, what unfortunately national catastrophe, being able to read the room, if you will, being able to not be tone deaf. That will help in keeping people engaged because life happens, and so if you have a work group and then life starts to lifing as you will start to shift your time and attention. So being able to just kind of be able to pull back in your group and say, all right, we know what's going on with you. How can we help? That'll keep people feeling like they're a part of it and that they're not just a fixture, if you will, of the group. Yeah.
Yeah, that's great. I might just add on from the employer perspective and union perspective, and unions are amazing organizers when they're engaged. The other thing that I would say is, as we saw in the aftermath of the event on December 4th, Americans are really fed up. And if you look at the oldest of the largest generation in history, which are millennials, they're actually a bigger generation than boomers. They're now in their early 40s. And one of the pluses with employers is they're providing healthcare every day, and they've been getting a raw deal for a long time, and the employees. And we've worked with all kinds of companies, but I would say the most common ones where there's pain and where there's sort of, I think, alignment with civic action is companies with like 50 to 500 with workforces during COVID times we'd call essential workers. That's where we've seen the most action. So manufacturing, trucking and logistics, hospitality, public sector, first responders, often family owned, civic minded, the sort of people who are, supporting Boys and Girls Club and the Y, and are often movers and shakers in the community. They're also the ones that they don't want to just shove the burden on the back of working Americans, and they've had enough, and they've been told for a long time they can't do anything about it. And that's by far the biggest obstacle that we have is most people think solving healthcare is like trying to solve Middle East peace. Like they'd like that solved, but it feels like it's out of their control and maybe hopeless. And if they believe that, they're right. If they don't believe it, they're also right. And like I said, we have thousands of successes. We highlight the best health plans in America. I mean, the reality is the best marketing, if you will, there is success. So we have these Rosie Awards, which is a homage to Rosie the Riveter. You know, when we had an existential threat to this country, people pulled together, played non-traditional roles, and did something. I believe one of the biggest existential threats we have to our country is our healthcare system. And that's why we have, you know, Rosie as sort of the avatar for that. The other thing I would say it's kind of interesting is the third largest healthcare economy in the world after the US and Germany, and soon to become the second, is the US out-of-pocket economy. So there's already about $500 billion that is actually dollars that can be redirected towards some of this change. And if you look at what we're doing specifically, it's already an industry that's bigger than the US video game or textile industry. Of course, nothing's big compared to 5 trillion, but it's actually quite large. And that can be empowering to people like, oh, this is actually happening. And it's a time where if you look at a measure of satisfaction of health plans, you know, as an industry, the net promoter score is lower than cable companies and airlines. So there is a frustration. There are successes that it's hope drives action. And that's really, for a while on my LinkedIn, somebody called me a hope merchant. So I just put that as my title for a while. There actually is hope here and something can be done. A lot of people don't realize that.
So Dave, as
I
a
know we want
follow-up
to take
that,
a lot of questions, but Patty, if you
Yep.
don't mind, I just want to build briefly on what Dave and Tasha just said.
Sure.
The Primary Care Collaborative has had success in promulgating new delivery models, and actually in the last 2 years, new payment models that Medicare has introduced. And that matters because it's the biggest, it's the largest payer. Medicaid covers more people, but it is, you know, one payer. When they make a policy, it has a huge effect on the whole market. So our conclusion over the last, you know, almost 17 or 18 years that we've been around is that a really important theory of change, and we've seen this actualized, is working across different stakeholder groups. Dave just gave us some real insight into the types of employers who are going to be most activated around this particular issue. There are consumer groups in your community who are very activated around this issue. American Heart Association has a local chapter. You know, folks that are really concerned about kids that have disabilities. Behavioral health folks are very concerned. There are local chapters of all of these different primary care clinician groups, AAFP, ACP. Those local chapters, they understand that there are real issues with primary care access in your community. There are FQHCs, which are federally qualified health centers, and PCAs. All of these groups have local representation and presence in your communities. So you get them together to work on this problem, you're going to have more success because you're going to understand this problem from all different dimensions, and this multiplicity of voices and movement around what needs to change, that carries a lot of weight when all these different stakeholders say this is how we need to move forward. So I just wanted to put that point on the table. The other thing is, in the playbook, one of the first things that the playbook suggests you do is to get some data about the problem that you're facing. And that is also very galvanizing to, you know, it's not just like an anecdote. It's not just that one of your neighbors can't get primary care. Once you start gathering that data and you understand how profound this is, that families everywhere are facing this challenge, it really gets people to focus on the prevalence And it gives them a sense of urgency that we need to make some changes. Thanks.
Absolutely, Anna. And when we think about this, Dave, sometimes I struggle with like, where do you begin? Right? It's like there's so much good to happen. So from your perspective, can you tell us like where should people sort of start looking? Is it the school department, the mayor's office, a local business, a union? Can you help sort of guide us to like a good starting zone?
Yeah, I mean it all the above, and pretty quickly you'll find people that are really energized and activated. My own town, the prior mayor, cared about healthcare but wasn't really animated. The current mayor, very animated, and that's with business. And so we're happy to take on any question, and there's a lot of good questions in the space about how you do it. But you pretty quickly find the people who are just asking questions just to delay and obfuscate, and people who are trying to do it to understand and activate. Um, and so talk to as many people as possible. You pretty quickly, in the case of I put some links earlier on one specific locale. As I mentioned, it started with a single private sector employer, just had 38 lives, was fed up. And then it did bounce over after a while into the public sector. And the public sector tends to move slower, but wow, the word of mouth is amazing. Like in that community, the school district, which was the eighth poorest school district in Ohio, they put in a new plan July of 2020, which kind of interesting time to put it in, and then had a school levy fail, which usually, even though it was a very challenged community, usually they'd pass the school levies. Even though it only 10 months had passed, it the new health plan, which was far better for the employees, getting rid of cost sharing and things like that. Um, Great primary care, very germane to this conversation. Larry Bauer put in a link there. They'd already saved more money in 10 months than the entire school levy. So that really spurred the word of mouth. And actually, the city manager was the spouse of a teacher. So then it went to the city. Now it's going to the county, continues with private sector. And so, again, just trust your gut. Are people actually wanting change, or are they just maybe they're defeated, but a lot of people have a vested interest in the old too. And so I'm happy to put them on, sort of a drip irrigation communication. I'm not going to write them off, but as I put in there, you only need 3.5%. And that's when these problems become solvable. Like that's not that many employers in a given neighborhood, community, city that can tip a market. And even the giant carriers, like the Uniteds of the world, in a lot of markets, they only have 5% market share. It's still meaningful. So that would be my sense, is just talk to everybody possible, and you'll see who's really frustrated and wants to do something. And I put in an example there of a plan grader. So we came up with the first sort of objective measure of a commercial health plan. And we're hard graders, but most people think they're spending a lot of money. They have a good grade. Most status quo plans get between a 5 and a 17 out of 100. And you show them there's actually way better than that. And that starts to shift mindsets too.
Thank you so much. Every sort of thing keeps coming back around to this idea of go find a person, right? We're not talking about like go get a meeting with the top company, go find the highest politician, right? It's go find a person to talk to. And I know, Tasha, you were around, I think you've done some work with Jack. I can never pronounce his last name correctly, so I won't do it right now, but he came on a while ago and taught us about the power of two, right? So, how have you seen this work on the like community level where you can find your one person? Like, where would you go? How have you sort of seen this happen?
Absolutely. I think um, community and organizing, it's about building relationships, like authentic relationships, fostering trust, creating spaces where people feel empowered and share their voices. So I think a power of two becomes the power of many when you take that two and you really do lean into listening. So if I were, say, in Chicago, I'm going to use that because I'm from Chicago. And Chicago is a very political town. It's lots of movement, lots of the Windy City, which was named the Windy City because of its political standing and not really the wind, although the wind is a serious thing. Starting with the one person. So my next step would be to focus on listening. We'd to begin to identify and reach out to storytellers, I think are really big a big tool and leverage when you're building trust in the community. People in the community with lived experiences that highlight challenges and opportunities within local healthcare systems. And so those stories are foundations of meaningful change because they can help us uncover the needs and the hopes. And I think, Dave, you just said something about hopes, and hope can ignite that passion. It can ignite the thing that keeps people going. And so, and barriers that are not always visible, just in data alone. And so having that person that you really can just sit and listen to the community with, it's helpful if that person has a really robust understanding of the community and the network where you can maybe tag team and maybe this person is not necessarily, I think like minds are great, but being able to leverage someone else who's not necessarily in your field, but I always say an adjacent kind of way so that you can really cast a wider net. And I think we also established listening tools. So in addition to storytellers, listening and understanding sessions. I don't say just listening sessions, but understanding sessions. And that can look like community forums, that looks like kitchen table conversations, which really are useful in communities that may feel they may have hesitations, they may have some trust issues from lack of just actual concern and lack of follow through from some of some systems that just kind of use them to get whatever it is they need. One-on-one interviews are really and are helpful. And when you have a smaller group, so if it's me and someone else doing a one-on-one interview, it feels a lot more organic and it feels a lot easier than me coming in with a big organization or a company behind me saying, we want to listen to your concerns, we'll buy you pizza, and then we'll disappear. And so these sessions are not just about the stories and collecting them, but they're really about building the trust and creating a sense of shared purpose, which I think is a huge part of, I guess, executing this playbook. It's got to be it's got to be a shared purpose. And so, I think that that's from there, we just identify common themes. And, there's always the missed opportunity of, you got the data, you've listened, but then what did we listen to? The so what of it all, why? And those create the opportunities for action. So ensuring that solutions we pursue are rooted in the community's realities, not just our understandings of them, but their realities, and leveraging those stories and insight to engage more people, including local leaders and stakeholders, organizations, and expand the network and amplify the movement. And that sounds really lofty for two people, I know, but it can be done because, again, the two become a power of many when people trust those two. And so that was a very long-winded way of saying we'd listen, we would plant ourselves in that community, and then we would take back the insight we gained to make actionable steps from that. So
No, that's super helpful, Tasha. I think, what's been really cool about being part of this particular movement for the last year for me is that it all started with a call from Michael Fine, right? Like, and it's so many people that I've been able to interact with or talk with along the way. As I prep people for our different Zoom calls, I usually start with, "Hi, Michael asked me to call you." And they're like, "What does he need me to do? I'm in it. Let's go." And so, with that, I do want to say thank you to the three of you. This has been the most active chat that we've had in a long time. I really encourage you to go look at it. We will hopefully have some time, but we will be looking at these things to see, how we continue to move forward through other Zooms as well. But for the moment, I do want to pass it over to Michael, who just to feature him for a minute and let him talk to us.
Well, thanks. And thanks to Anne, to Dave, and to Tasha for being with us tonight and for their leadership. And to the Playbooks work group for helping us develop all these options about the different ways communities can come together and focus on providing primary care to everybody. We know that there's no one size fits all, that each community is going to do it differently, and that's a really good thing. Let me tell you, I got to be a little part of the work groups that are cooking in New Bedford and in Central Falls, Rhode Island. And watching them grow from, 2 or 3 people, sorry, to in New Bedford, 40 people all across the community, kind of excited about the things that they're going to be able to do together. And the excitement is actually palpable as people invent ways to do things like count the percentage of the population who actually have access to primary care now. That's data nobody has yet, but I'm hoping we'll see it in Central Falls and New Bedford reasonably soon, and can teach other places how to figure out how to develop that data, and to see them figure out work plans, and then figure out subcommittees to work on the work plans. And you can see this changing the reality on the ground, kind of right in front of everybody's eyes. So, if you're listening, now you have all the tools you need to get started. Pick one person in your neighborhood or community, or 2 people, or 3 or 5, and start a work group, or start a state work group if your state doesn't have one yet. When my practice started, we did a very cool little art contest for kids to talk about, what it was like to come to the doctor. It was a great way to make it comfortable for people. And we got great pictures. We got probably 40 great pictures that we mounted and posted all over the practice. But the one that I think was everybody's favorite was one that said, "Don't be scared, come on in." So if you're listening to this, all I can say is don't be scared. Find one other person or 2 other people and get started. It's a new year full of new possibilities. Let's finally stop admiring the problem and start fixing it ourselves and fixing it together, not waiting for the cavalry to arrive. Let's get this thing done together. Thank you all for all your work and for being with us tonight.
Thank you so much, Michael. And thank you to Matt Libby and Sarah Pastor, who have been answering so many of the questions that have been coming through the chat. Don't forget to go back and read through this amazing playbook. In about 1 month, we will be meeting again. We encourage everyone to invite someone new to get involved in this impactful movement. Let's continue growing. Let's continue getting people involved. Find your one person, invite them to this call, invite them to be part of the conversation. Mark your calendars for our next Zoom meeting on February 11th. That's when we'll be hearing from Allison Warfel about how to tell the story of your community. We look forward to seeing you there. You can register on our website, www.primarycareforallamericans.org. While you're there, you can click on volunteer in the contact us section of the website. Tell us how you'd like to be an active part of the movement. Maybe start your own local playbook. That's where you can get started there. You can also donate to support our efforts with a contribution, because every little bit helps. Every little bit makes a big difference in advancing our cause. Actually, I'd like to introduce one of our board members, Scott Connard, who's going to be sharing why donating to primary care for all Americans is so important. Scott?
Thank you so much. And I realize it's late and we want to go. But, I've been a part of this movement from the very beginning, and I so appreciate the hard work that's gone into it. And those of you who've come on board, like the two of you who did this plan, it's such an amazing gift. Just a quick digression. This afternoon, I was on the phone with a state, and they said, we're really committed to advanced primary care, but we don't know what to do. Well, I sent them a copy of the state and the local playbook, and they're like, this is what we've been looking for. And so stay tuned. I won't say which state it is, but they're actually in motion, taking what was created by this group and handed, and what Matt particularly and Sarah have worked on so hard and created, and figuring out how to take and spread that across their ecosystem, asking each organization in that ecosystem to do their part. But the reason I'm here is I've asked so many people to join Primary Care for All Americans, and I've had a whole lot of people who've joined. But I've always promised them, just come learn, get the email, find out what we're up to. It's not a hard sell, and you've got to volunteer and you've got to pay a bunch of money and things. But as a board member, one of the things that occurs is we do need funds to move things forward. So in looking at that, the way that I went and asked foundations and family offices, would you please donate? And they said, as you grow a little bit, you get more membership and you get more projects, come back and talk to us, but not now. So what I took away from that is, what can I do right now that will make a difference? And so what I did is sat down with my wife and said, I'd like to donate a little bit every month. Because when we get to $5,000 a month that is just coming in and committed by people, we're going to hire a full-time person. But until we get to an absolute amount of money that we know is coming in, we don't feel as a board it's responsible to do that. So she said to me, well, here's what I think we can afford right now. And, I actually came up with a number. She said, yes, that works for me. And so every month we make a donation. It's not very big. For some people that might be $5. For us, it's a little bit more than that. But we now have over $1,000 that people are donating each month, just everything again from $5 to $200, that is going to fund us bringing on full-time staff. And so I would ask you all to look in your hearts, see if you have any willingness to do something like that. But as soon as we hit $5,000 a month, we'll be bringing on additional staff, and we'll just continue to see this growth go up even faster. I'm very blessed this holiday season. The highlight of it was for me being with my grandkids. And when I was with them and spent this wonderful time with them, I worry about the future of America. I worry about the destruction as we've seen, and in the books that have been written and shared tonight for free. So I really strongly encourage you, go get Dave Chase's books. We're seeing the middle class of America devastated by healthcare costs, and it's not a good investment the way that we're doing it today. And so I look at my two granddaughters and say, when they look at me and say, Grandpa, what did you do to help us? They call me, by the way, Yo-Yo. So Yo-Yo, what did you do? Or what happened? Why are things so hard, and why is there so much social unrest? Because so many people are unhappy, which is going to happen as the middle class gets bankrupted, which it is right now. I want to be able to say I every month supported the most important thing for getting America back on its feet, and that's effective primary care. When we have effective primary care, specialist utilization goes down, hospital utilization goes down, pharmacy costs go down, and we literally can fix the entire system through advanced primary care. And things like leaders like Alan Roth with the organization that he leads, and Dave Chase with the organization that they lead, with all of the broker consultants that are working so hard and so forth. One company at a time, we can fix healthcare by fixing primary care. And so I would ask you all to look in your heart, and if you would be willing to just put some amount, whether it's $5 or $50 a month, toward what we're doing. again, if everybody on this call tonight agreed to put $5 on the call, we're that much closer to having full-time staff to take care of and build this movement. So thank you all for being here. It's such an honor. It's such an honor to be associated with such great people. And the difference that we're going to be making, and we already are making, is legion. So thank you.
Thank you so much, Scott. Yeah, a little bit goes a long way when we all come together and work on it. So thank you guys for coming together, joining us tonight. We appreciate every single one of you helping to spread this movement across our nation in order to get the change you deserve. Follow us on social media. Keep in touch. You can also complete our survey, which we just dropped into the chat. We do want to hear from you. We will be responding to different messages that come through to us. We want to grow as a community. Find your one person, use the power of two, use the resources that are on here, bring others along, and we will see you on February 11th. Michael, any parting words?
Patty, I think you got it covered.
Right.
My one last addition to what Dave just said in the chat about bankruptcy and the 100 million Americans in debt to healthcare is that only 43% of American adults have a robust primary care relationship. Let's fix that. And most of us think that that financial distress goes away as our public health outcomes improve. This is something right in front of our face and something we can do together. Thanks to everybody. We'll see you in a month.